As a pharmacy technician, I come into contact with a lot of healthcare professionals, and I am aware of certain laws that surround prescribing medications. Here in Texas, when a nurse practitioner or a physician's assistant writes a prescription, it is accompanied with the name of the supervising physician. While I was under the assumption that this was something that all states did, I soon realized that was not the case. While we don't have this happen often, every once in a while we have doctors, physicians, assistants, and nurses practitioners walk into the pharmacy and ask to write a prescription for a patient. Almost all the nurse practitioners and physician's assistants that are in the area are already linked to their supervising physician in our system. But when they come in from out of town or out of state, this can be a hassle, and in this particular case, she was coming from Alaska. A few weeks before this project was assigned, we had a nurse practitioner come in and ask to write a prescription for an antibiotic. After checking her credentials and taking the verbal script, we asked her for her supervising physician's information, to which she replied, "I don't really have one. I can usually go to any pharmacy in Alaska and write a prescription without one." After consulting with the pharmacy manager, we were able to fill the prescription without a supervising physician due to the nature of the medication and the special circumstances of the nurse practitioner. While I did not think much of it at the time, I now understand why this particular scenario was allowed.
The encounter with the nurse practitioner instigated a curiosity to research the bulk quantities of pharmaceuticals she was collecting and its use. Could the vastness of Alaska and its isolation of many towns stir a need for dire implementations of medical services? Does telehealth come into play? Under the Board of Nursing for Alaska, nurse practitioners are under the regulation of what's called full practice, meaning that they can evaluate patients, diagnose, order and interpret diagnostic tests, initiate and manage treatments, including prescribed medications, without the involvement of a medical doctor. Under recent House Bill 281, her scope of practice, telemedically, just got larger. Recent implementation of the House Bill 281 in 2014 will allow primary care physicians to consult, make diagnosis, and now provide prescriptions through the phone without having to have an in-person visit. State Representative Lynn Gattis stated, "Nowadays, much of our life is conducted online or over the phone. In this age where we can do almost everything with the smartphone, it should not be necessary to drive to the doctor's office to have a physical consultation for many common ailments." Lynn also included that with 20% of the Alaska population living in rural areas, it is crucial that routine and common ailment care be quick and economical as possible. Under current statutes for telehealth in Alaska, practitioners are provided payment through 1. Live or interactive service provided through the use of camera, video, or dedicated audio conference equipment on a real-time basis. 2. The use of store and forward, a telecommunications process where digital images, sounds, or previously recorded video is sent to an intermediate for clinical evaluation and is then sent back or to a final destination. And lastly, 3. Self-monitoring or testing services must be provided by a telemedicine application based in the recipient's home. Under House Bill 281, the provider can prescribe drugs without a physical examination if 1. The drug is not a controlled substance like morphine, 2. The physician is in Alaska and can provide follow-up care, and 3. The person consents to sending a copy of the records to the person's primary care provider if the prescriber is not. Of course, these new additions not only affect the scope of practice for this nurse practitioner, but all prescribers as well. Like Gaddis concluded, this expansion of telemedicine capabilities is for the aid of all Alaskans, especially those normally in disconvenience because of their location.
According to Swagel, one could argue that some very significant technological advances in the bush Alaska started with kids' earaches. It would appear that the ear, nose, and throat otolaryngology department in the Alaska Native Medical Center would also agree. Located in Anchorage, the Alaska Native Medical Center is currently one of 2 Level 2 trauma centers in all of Alaska, and with more than 50% of their patients located outside of this area, telehealth is crucial for proper care and health cost alternatives. Created in 1998 and managed by the Alaska's Tribal Health System, the Alaska Federal Healthcare Access Network, AFCAN for short, is leading the way in technological advances in medicine in rural Alaska. AFCAN has developed live video teleconferencing, remote monitoring, and store and forward technology. This means that in the case of a child with an earache, a clinician in a rural town can take digital pictures and send them to one of the many medical doctors in the Alaskan Medical Center for further analysis. From there, the medical doctor can study the severity of the earache and decide further treatment. This not only saves the patient money, but also allows for a faster diagnosing, since they would not have to travel from a rural area to Anchorage. When asked to describe a case in which telehealth improved a patient's care, Dr. John Kokesh had this story to describe. A case involved a request for assessment of a 50-year-old female in a remote village with an unusual ear examination. Using the image, we diagnosed a condition as cholesteatoma, a skin cyst growing into the ear, which can damage the hearing bones. We contacted the patient immediately to come in for surgery at the Alaskan Native Medical Center, and we arranged for her flight transportation. The timely surgery saved her hearing. One of the cool innovations that AFCAN has come up with to make telehealth more user-friendly is the AFCAN telemedicine cart. Designed small enough to fit through a doorway, this portable cart has wireless network capabilities that allow the healthcare professional to automatically gather patient information from external imaging devices such as ultrasounds, capture information from integrated biomedical peripherals such as digital cameras and video otoscopes, all while also allowing the healthcare professional a way to forward the information to other professionals at distant locations for further review.
Although all of these innovations and practices of telemedicine are improving their access to healthcare, there are still current medical challenges that telemedicine has not alleviated in Alaska. Take the remote community of King Cove, Alaska, for example. For 20 years, politicians have lobbied for a 20-mile gravel road to be constructed between King Cove through Izembek National Wildlife Refuge to the neighboring larger town of Cold Bay. Recently, because of medical emergencies, the local residents have exclaimed for the need of a road as well. Like many other communities in Alaska, King Cove's only way out is through air or marine transport, which has become especially hazardous during harsh Alaskan weather. Residents have expressed that the approximately $48 million that they received in 1998 to build a telemedicine center and hovercraft to transport them to Cold Bay has not solved medical challenges they face during inclement weather, such as 11 residents who died in a plane crash due to a medical emergency. The need for this road is so great that King Cove residents are willing to construct the road despite possible repercussions it could create for its nearby designated wilderness. They are willing to exchange 56,000 acres of their land for 1,806 acres of the wildlife refuge. Regarding House Bill 281, the Alaska State Medical Board wrote a letter to Senator Fred Dyson and Representative Lynn Gattis concerning possible consequences of changing practice standards because of the telemedicine expansion. They place concerns over misdiagnosis and overprescribing associated with no medical examination of the patient, potential liability and investigative costs related to misdiagnosis, and decreasing the standard of care through Alaska. Whether these worries have so far occurred in Alaska has not been researched.
Dr. Ferguson estimated that in 2012, the telehealth program saved the state of Alaska $8.5 million in travel costs for Medicaid patients alone. Cumulatively, for all patients, there is a conservative estimate that telehealth has saved the state a total of $38 million since 2003. The need to travel was eliminated in 75% of patients involved in specialty telehealth consultations and in 25% of patients involved in primary care telehealth consultations. Compared to many other states, Alaska is a leader in telemedicine and e-health practices. In 2012, the Alaska Native Tribal Health Consortium's Telehealth Technology Assessment Center, also known as TTAC, was granted $1.2 million by the HRSA, a part of the U.S. Department of Health and Human Services, to spread telehealth help across the United States. Alaska's TTAC is now in charge of providing telehealth technology, evaluations, and education to upcoming telehealth programs nationwide.